In today's health checkup, it is possible magic mushrooms and LSD could soon be used as mainstream behavioral health treatments. The Food and Drug Administration released some new guidance regarding clinical trials using psychedelics. Scientists have been looking at psychedelics as potential treatments for psychiatric and substance abuse disorders. The FDA says that while these treatments have shown promise, clinical trials still need to be measured and are cautious. Joining me now to talk more about it and some other health headlines, emergency medical physician and medical director, Dr. Richina Bicette-McCain. Thanks for being here as always. Do you think the benefits outweigh the risk when it comes to psychedelics? What's your message on this?
I think it really depends on dosing, the environment that the drug is given in, and making sure that we are doing things in a controlled manner. Psychedelics have been around for decades. They were first discovered in the 1940s, and between the 1950s and 1960s, it's estimated that almost 50,000 people were prescribed LSD, including children with autism. I think a big part of the reason that they've been outlawed and made to be illegal in the past had to do with political reasons. They were associated with what's commonly called the hippie culture. But there has been promising studies showing that LSD specifically and magic mushrooms can potentially help people with addictions to alcohol or nicotine, obsessive compulsive disorder, depression, anxiety, and the list goes on.
So supervised experimenting with these drugs is the safe and most effective way to use it. Heard on that one. Okay, let's talk about the heat risk, because so many areas are being impacted right now by extreme heat. It's hovering over Texas right now. 45 million people, doctor, from Arizona to Alabama are under excessive heat warnings or advisories. And forecasters say some areas could set some records. Cities expected to see triple-digit temperatures this week, and it could be sticking around through the 4th of July. So as we head out to the barbecue, maybe if we don't have a lot of shade nearby, what are some of the greatest risks that heat pose health-wise to our bodies?
You know, Marni, heat-related illnesses are one of the top weather-related health risks out of all. I'm feeling the heat right now here in Texas. We've definitely hit triple digits. There have actually been a couple of deaths in the last few weeks from a family that was hiking in 119-degree weather. So things that you want to be cognizant of and to look out for. First of all, try, if you can, not to be outside during the hottest times of the day, which is typically between 11 a.m. to 3 p.m. If you do have to be outside, make sure you're wearing your sunscreen, hydrate even more than you think you need to, drink water consistently. If you start noticing that you're feeling very, very hot, immediately move to a cool and shaded place. Excessive sweating, headache, nausea, muscle cramps, those are all the beginnings of heat-related illness. If you are with someone and they begin passing out or are confused, they have slurred speech or are having seizures, you immediately need to call 911, because those are signs and symptoms of a heat stroke, and that's a medical emergency.
Yeah, we don't want to mess around with that. So stay cool, stay hydrated. One more topic for you this morning. Researchers say we're getting closer to a potential cancer vaccine. The vaccines are not traditional in the sense that they prevent disease, but they can be used to possibly shrink tumors and keep cancer from returning. Some of the new ones, they use the mRNA technology, which was developed for cancer, not for cancer, but also for COVID-19 vaccines. What's your messaging on this? It seems like a potential game changer. What do you say?
Absolutely seems like a game changer, Marni. Some of the research that I've seen specifically has been done on subjects that have pancreatic cancer. And pancreatic cancer is one of the most deadly forms of cancer. Only 12% of patients who are diagnosed will survive at 5 years post-treatment. The fact that researchers have been able to extract DNA from these particular subjects' cancer cells and create a vaccine targeted to their specific cancer is remarkable. For those who have mounted a response to the vaccine, they've seen that the cancer has not recurred in over a year and a half, which is amazing news. Now, the particulars about the vaccines that have been publicized thus far are that they are individualized. They require extracting cells from a particular person, and then the vaccine is created, which means it's time consuming and it's going to be costly. These studies have also been very, very small. The study on pancreatic cancer looked at 19 subjects. There's been another study on skin cancer that used 150 subjects. So I don't know if the research is widely generalizable thus far.
Less than a minute left, but what would the FDA and researchers need to do to answer important questions before something like this would hit the market?
Well, I think if we have the potential to save one life from a cancer diagnosis, or we have the potential to change the way that we're treating cancer, that is significantly going to move the FDA, because there are so many cancer-related deaths and morbidity associated. Now, again, these trials have been very, very small scale, so they do need to be a lot larger before we begin to generalize results. There has to be studies on safety and efficacy.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.